started having knee pain when I was about 16. Actually, it came back. I had it a bit before. They said that my kneecaps were just odd. So I started with knee pain, and then I had some back problems as well. And then one day in school, I had my lower right leg started to really hurt for no apparent reason, just during school. And it was by coincidence I went to the doctor that day for my knees, and she said I had shin splints. For the next couple days, I was fine. I felt the pain, but it wasn't that bad. And then over the weekend, both my legs started hurting quite a bit, enough so that my parents took me to the emergency room. They pretty much said it was probably sprained or pulled muscles from working at a farmer's market. And they just sent me home for like rest. And then a couple days later, I hadn't attended school, and the pain spread to both my arms. And it was severe. I could barely move. I could barely walk. Went back to the emergency room, and after they did some tests, including a spinal tap, they hospitalized me for observation. And with that, I was put in the care of a pediatric neurologist who put me on medication to help the pain, and it did lessen the pain, but it still was very intense. And that was how it started, the chronic pain stage for a few years. And I went to different doctors, different specialists. I had many different diagnoses, including myofascial pain syndrome, fibromyalgia, mycoplasma, and that summer when I first got sick, we ended up going to the Mayo Clinic. I had chronic pain in both my legs, both my arms, and I had other symptoms such as fatigue. I had some balance issues. I had automatic nervous system issues. I had headaches quite a bit. And that went on for the summer and many years. It completely changed my life. I went from, when I first got the pain, I went from being 16, and I had friends, I had a job, I had new dogs that we were taking care of, and I was also involved in extracurriculars in my town. I went from that to doing nothing over the summer, really. I wasn't able to go back to high school. I lost contact with my friends. I couldn't be social at all. I left my job. I couldn't really do anything. All my focus was on school and trying to get through school from home. When I was 16, well, from the time I was 12 to 16, I had gone through, my family had gone through a lot of issues with my older brother, including depression, suicidal, social anxiety. So we dealt with that for about 4 years or so. And at that time, because the family was so focused on that, I didn't really worry about how it was affecting me. I just worried about school, about just doing my own thing, and so that my family could focus on my brother. And when I saw you, you helped me realize that I kind of learned to just keep my emotions inside, to not really express them, to not really worry about them, because I was going through that when I was younger. And so once I learned that that was how I was kind of wired for a bit, and that expressing those emotions would be the best thing to do, would help. It was very stressful and quite severe. It took over the family, the majority of the family, and our attention. He was very troubled. He had a lot of issues that some were quite severe. He did not try to commit suicide, but he would talk about it a lot. Sometimes he would get upset enough that you wondered if it would go to violence, if he would cross that line. He didn't really, but he would have outbursts and arguments with my parents, my mom especially, where it would scare me. I mean, this started when I was about 12 until I was about 16. And so I was dealing with this all through that, and he started when he was about 15. And so it went on for quite a few years, and it was very stressful, very troubling, and very upsetting to the entire family. I am pretty sensitive. I have pretty much always been a people pleaser. I've wanted to be good and not really have people worry about what I'm doing or worry because of how I feel, stuff like that. That's always been me ever since I was little. When I started the online program, honestly, I was very skeptical. I couldn't believe that writing could lessen pain that I'd been in for 3 years. That had changed my life. But I was willing to try it. I didn't really have any reason not to. So I started writing, and the pain got worse. And so that was when I was pretty sure that it was spot on, that it was right, that there's some merit. And because I got so much worse, I wasn't really sure what to do about the program. When I saw you advised me that it was okay to just back off and do a little bit so that I could go back to normal activities and go back and return to school when the semester started up again. As I continued, first I slowed down so that I wasn't going so fast, and then slowly the pain went back to my base level before I started writing, and then slowly I just noticed the pain less and less. I'd go a day and realize I didn't really ache that day, or I didn't have a headache that day, or another symptom went away, or something like that. I just have more and more days like that. It took about a month to where I didn't really notice any pain. Other symptoms went away. The headaches got better. Ecstatic. I got life back. I was doing well in college. Because I was doing so much better, I was able to handle going to class, and I also started having a social life. Since before that, I had basically been isolated from people my own age because I couldn't focus my energy on being social. I had to focus on school. So because I started feeling better, I was able to start making friends. I've actually had some old nausea come back, quite severe, when first I thought I was actually sick, but I was dealing with finals at college, and I got sick the weekend beforehand when I was trying to study, so that was fun. But after finals, I got better, went away, and so I'm like, dang it. I'm like, dang, I was upset about finals again. I'm like, okay, all right. So I learned that that's a reaction I have to stress or anxiety or something. And then a couple weeks later, I was dealing with some personal issues, and that came back. And at first, I didn't get it. I didn't get it. I'm like, why am I sick again? And then my mom and I talked, and I helped realize one of my old stress reactions when I'd have like a medical test done would be nausea. And once I realized that, I started feeling better. And then the next day and a few days later, I went back to writing since I had neglected it for a couple weeks since I was studying for finals. I started writing, and I was fine. It went away. And so now I learned that that is a symptom that my body is trying to deal with since my chronic pain is gone. It moved on to a different aspect.